In this video, we're going to look at some of the parts of the upper digestive tract, and we're going to start with the mouth or the oral cavity that you can see here. So on the exterior region of the oral cavity, we obviously have the lips on the anterior side, and then we have cheeks on the lateral sides, kind of enclosing the oral cavity. Now inside of the lips and inside of the cheeks, we have what's called the vestibule, which is a space in between those regions and the teeth. So you can see the teeth inside of this oral cavity as well, and we will get into those in a little more detail in a later slide. But inside of the teeth we have what's called the true oral cavity, and so this is where food will be placed in order to be chewed, in order to be mechanically broken down, chemically broken down as far as some food groups go, and physically broken down into smaller pieces that can then be formed into a structure called a bolus, which can mix with saliva and make it more easy to swallow. So again, the whole function of the mouth in regards to digestive purposes is to allow us to ingest food, to physically, mechanically, and chemically digest that food, or at least start the digestive process of that food, and allow us to taste that food that we are beginning to digest as well. Along with that, it allows us to be able to swallow the food, to send it to the esophagus. The mouth also aids in speech, and it's going to aid in respiratory function by allowing us to be able to breathe through the mouth, especially if the nasal cavity is closed off. So the lining inside of this mouth is going to be lined with stratified squamous epithelium because it's going to be constantly exposed to friction or abrasion whenever we are chewing food and moving it around in our mouth. And again, major purposes of this are to retain food, allow us to swallow food, allow us to speak, and perform respiratory functions as well. So looking down here on the inferior portion of the mouth, we have our tongue. The tongue is a very muscular organ that is capable of manipulating food and moving food around between our teeth to allow us to more easily chew that food and start that digestive process. We also have papillae on the tongue that are used for taste purposes, allow us to taste our food. And you'll notice that the tongue is attached to the floor of the mouth by what's called the lingual frenulum. That's this little piece of tissue here attaching the tongue again to the floor of the mouth. Now underneath the tongue you can see the opening of some of the salivary ducts. We have a sublingual salivary gland and a submandibular salivary gland that open up underneath the tongue to provide saliva to the floor of the mouth to help moisten that food that we are chewing and trying to start that digestive process up. Now on the roof of the mouth we have what's called the palate enclosing the roof of the mouth. So we have a hard palate on the anterior surface, which is made of bone that's covered by some connective tissue, mucous membranes, and then we have the soft palate towards the posterior half of the oral cavity, which is a more spongy tissue. It's a lot softer, which is why it's called the soft palate. It's a lot more flexible. It has some glandular tissue and some skeletal muscle comprising it. And hanging down off of that soft palate, we also have the uvula here. So these structures, the soft palate and the uvula, are very flexible so that when we swallow, they can fold up and cover the nasal cavity as we are swallowing food or drink and prevent those materials from getting into our respiratory system. You'll also notice palatine tonsils in the back of the throat. Remember, these are part of the lymphatic system. They contain lots of white blood cells to help capture or trap any bacteria or other pathogens that might come in to the mouth through the food that we are eating. So let's move ahead to the teeth and look at those a little bit more closely. Now we know that the major function of teeth is to break down food into smaller pieces. It makes it easier for us to swallow that food, and it's going to help speed up chemical digestion of that food by allowing those smaller pieces to have a greater surface area to come into contact with more enzymes, more chemicals in the saliva to start that digestive process. Now we have two sets of teeth throughout our life. We start with what are called our deciduous teeth, also known as our baby teeth. And they're called deciduous because they end up falling out of our mouth just like deciduous leaves fall off of trees in the fall. So we have 20 overall deciduous baby teeth. We have 10 on the top and 10 on the bottom. And in the center, you'll see what are called the central incisors. We have 2 of those on top and bottom. We have lateral incisors outside of that, so we have 4 incisors overall. These teeth are going to have they're going to be shaped almost like a blade to allow us to be able to bite into food. So like to bite into an apple, for instance, we typically use our incisors to do that. Now, lateral to those, we have one set of canines, which are typically going to come to a point and be a lot sharper. Those canines are used for piercing or puncturing into food, mainly going to be involved in helping us to puncture into things like meat. You'll notice that other animals that are purely carnivores will have much sharper canines than we do to allow them to eat meat more frequently. And then outside of the canines, we have what are called the molars. So in our adult teeth, we have premolars, and then we have molars. You can see we have 2 sets of molars in these baby teeth here. So these are more blunt, they're a little more flat on the surface, and their purpose is to crush or grind food. So these are going to be really involved in helping us grind up, especially vegetative matter, which means that herbivores, animals who only eat plants, they're mostly going to have these molars as their teeth. They have a flat surface to work almost like a mortar and pestle to help grind food up and break it into smaller components that are more easily digested. Now our permanent teeth, you can see we actually have, if you have all of your permanent teeth come in, you will have 32 of these total. And so again, you still have the central incisors, the lateral incisors, the canines. Outside of the canines, you have 2 sets of premolars, which typically come in between 10 and 12 years old. Then you have your first set of molars, second set of molars, and then your third set of molars, also known as your wisdom teeth. Now, some people's third set of molars actually never come in, and then some people will end up having their third set of molars removed due to crowding of the teeth. If you start to have too many teeth in that space, you don't have enough room for them, these wisdom teeth typically get cut out or removed later in life to prevent that crowding in the mouth of the other teeth. Now looking at an individual tooth, the anatomy of an individual tooth, you can see there are 2 major regions to the tooth. We have what's called the crown of the tooth, which is the part that sticks out above the gingiva or the gum line. And then we have the root of the tooth, which sits below the gum line. Now, looking at the crown, you will see the outer layer of the tooth is called the enamel. This is made of very, very hard connective tissue. It is living tissue, and it is not capable of regeneration. So the enamel, this is the non-living portion. So the dentin is the living portion of the tooth. The enamel is the non-living portion of the tooth, which cannot regenerate. So if you were to damage the enamel, if you were to soften it and actually remove some of that enamel, it would not be able to repair itself, and you would have to have that artificially replaced or artificially repaired by having something done by the dentist to repair that enamel. Now the dentin is deep to the enamel, and this is the hard living connective tissue. Okay, so this is a living portion of the tooth that can regenerate if necessary, if it is damaged. But again, you have the enamel outside of that which cannot regenerate. So if you damage this and end up damaging that dentin, you've probably got some serious problems going on with the teeth. Now deep to the dentin, we have what's called the pulp cavity, which you can see extends down into the root canal here. And inside of that pulp cavity, we have some soft connective tissue. We also have some blood vessels, some nerve supply, and some lymphatic vessels as well. And if you ever get an infection of the pulp cavity or this root canal, they have to perform a root canal at the dentist, where they go and drill into the tooth to remove that infected tissue, scrape it out, and then they will inject cement typically into that cavity to repair the damaged tissue or replace that damaged tissue within the tooth. Now outside of this dentin that you can see colored in yellow here, we have what's called the cement. So the cement is going to help hold or glue this tooth in place and prevent it from moving in that cavity, in that alveolar socket. We also have what's called a periodontal ligament, which is made of dense regular connective tissue that is there to physically hold that tooth in place and prevent it from being able to be removed from that socket. So this helps form what we call a gomphoses, which is a peg and socket joint. It is an immovable joint between our teeth and the alveolar socket that the tooth sits in. And if you were to try to remove this permanent tooth from that socket, you would have to physically tear this periodontal ligament in order to do so, because it's permanently holding that tooth in place. Now we get to the salivary glands, which are going to be producing saliva for us during this digestive process. Saliva is a watery solution that's going to help moisten the mouth and help moisten the food. It's going to help clean teeth. It's going to help inhibit bacterial growth by dissolving, certain types of bacteria using enzymes that might come into the mouth. And then it's also going to help dissolve molecules in our food so that we can release the chemicals from that food in order to be able to taste them using our taste buds. It's also going to help lubricate the food and help us form that food into a bolus, which will make it easier to swallow. So we have what's called salivary amylase, which is one enzyme that's found in saliva, which is going to help us digest starch, which are complex carbohydrates that we have in certain foods. And we also have lingual lipase, which is an enzyme found in saliva that can help aid in the digestion of fats. So those are two enzymes that help aid in that digestive process chemically. But you'll see there are three sets of salivary glands in the mouth. We have the parotid glands, which are kind of right underneath the ear in the posterior half of the oral cavity. We have the submandibular gland under the mandible or next to the mandible. And then we have the sublingual gland, which is right underneath the tongue. And so you can see the openings of these ducts of these glands. Again, they're producing saliva, secreting that saliva into either the roof of the mouth or the floor of the mouth, depending on which gland you're looking at. But that saliva, again, is going to help aid in this digestive process in all the ways that I just mentioned. Now, once we've chewed the food with the teeth, we've secreted the saliva to mix in with that food and start that chemical digestive process. We then have to form that food into a bolus, which looks like a little oval-shaped small piece of food here that can then be pushed to the back of the mouth and allow us to swallow. So swallowing is actually going to consist of three phases. And it's going to be allowed for by both our mouth or oral cavity and the pharynx, which is back here in the back of the throat. So we talked about the pharynx briefly in the respiratory system. Remember, we have the nasopharynx at the top, the oropharynx behind the oral cavity, and then we have the laryngopharynx here, which divides into the larynx and the esophagus. Now remember, the larynx is only used for respiratory function. Food should travel down the esophagus, which is posterior to the larynx. So looking at the oral phase first, this is where we will chew the food up, we form it into this bolus, and we use the tongue to push the bolus back into the oropharynx and then down into the laryngopharynx. Once the food has made it into the laryngopharynx, the pharyngeal phase will start. And so this is when the food will be pushed using some skeletal muscle down towards the beginning part of the esophagus. This is when the epiglottis will fold over the opening of the larynx and prevent that food from entering our airways. And so when this happens, breathing will stop temporarily because we won't be able to get air into the larynx because the larynx will be closed off by the epiglottis. So you won't see any breathing during this pharyngeal phase of swallowing. Now once that food has made it down into the esophagus, it will travel down through the esophagus using what we call peristalsis contractions. So these are wave-like contractions. They're allowed for by smooth muscle found in the walls of the esophagus, and it will squeeze this esophagus and push that material in one direction towards this cardioesophageal sphincter here, which can close once that bolus of food enters into the stomach and prevent any stomach acid from regurgitating back up into the esophagus there. So the oral phase up here is going to be under voluntary control. We have conscious control over this phase, whereas the pharyngeal phase and the esophageal phase are both going to be involuntary, meaning we don't have conscious control over those. They're mainly going to be regulated by some smooth muscle and reflexes that we have as part of our digestive tract.